I would now like to call upon our next speaker to share some government perspective on successful partnerships with NGOs and how a more collaborative approach is helping solve India's most pressing social issues. May I please call upon Dr. Sushma Dureja from the Ministry of Health and Family Welfare, Government of India. Madam, please come.
Good morning, dear all. It's indeed a pleasure to be here today speaking with the torchbearers of our vibrant civil society. It is an encouraging sight to see so many leaders of India's social sector here together to discuss, deliberate upon, and to learn from each other so that we can work together to better achieve India's sustainable development goals. At Ministry of Health and Family Welfare, we have set ambitious goal to improve India's health outcomes. And we do acknowledge that to achieve these goals, we must recognize and respect the role of civil society and work together to achieve the desired outcomes. In spite of understanding the intractable challenges, we do recognize that the civil society has a vital role to play, especially in supplementing the efforts of the government in the last mile service delivery to the population. NGOs have a distinct advantage in delivery of healthcare services as they have a deeper understanding of the socio-cultural, economic context of the beneficiary population and also have a wider reach among the marginalized ones. To this aim, the ministry has designed many schemes to involve NGOs in the delivery of national health programs to tackle health issues like tuberculosis, leprosy, blindness, HIV/AIDS, cancer, and reproductive and sexual health. The ministry runs a unique scheme delivering reproductive, maternal, and childhood services through mother NGOs, which manage and fund smaller NGOs, the field NGOs, to reach the hard-to-reach and underserved regions in India. Realizing the need for further enhancing services of delivery of services to the masses, the scheme is now being implemented at the state level as well through the service NGOs, which is being soon introduced. The guidelines from the ministry incorporate details from these schemes. There also exist several provisions in adolescent health program, Rashtriya Kishore Swasthya Karyakram, RKSK, that enables the participation of civil society for enhancing delivery, accountability, and driving quality of services. Right from its inception, when RKSK was designed and launched in 2014, voices of civil society were duly recognized and incorporated. A great example of civil society collaborating with government is the Kantar Youth Poll that ministry is conducting with support of DASRA and USAID. We needed a rich and broad-based picture of rapidly changing adolescents and youth situations, particularly with respect to access to livelihood, skill training, gender role, other attitudes, menstrual health, menstrual hygiene practices, and last but not the least, awareness about the access to services and participation in programs. The idea was to fill in the gaps in understanding resulting from time delays in the usual large-scale collection exercises done by the government. The survey is designed to run in 7 states, and the data so gathered would be of relevance to a range of government ministries, as well as the civil society, organizations, researchers, and the donor community. It would also help the government to implement evidence-based and evidence-informed program once the findings are available with us in the next few months. Another glorious example of collaboration with civil society is Project Asman, an alliance launched in 2015 between Bill and Melinda Gates Foundation, Michael and Susan Dell Foundation, Reliance Foundation, Tata Trust, and USAID. It aims to reduce infant, neonatal, and maternal mortality in India. The first of a kind major alliance has structured its model in consultation with the National Health Mission of Government of India and will be working in tandem with the governments at the central and the state levels. Similarly, another project, Piramal Swasthya, is a non-profit initiative which works to improve access to as well as timeliness of healthcare interventions through technology-based platforms across 12 states in India. It illustrates how NGO-government partnerships are key to achieving impact at scale and reaching underserved communities. The interventions that scaled from pilots to adoption by government across states included provision of mobile medical vans and a state-of-art helpline call center at Andhra Pradesh, which responds to around 50,000 phone calls every day. In Assam, another state of India, the foundation collaborated with the government to register all pregnant women in the state and then track and monitor their pregnancies. The partnership has identified and screened over 69% of high-risk pregnancies and has been able to increase the institutional deliveries to 81% in tribal rural areas. The same model has been expanded to Rajasthan and Arunachal Pradesh also. NGOs have also played a strong role in mobilizing communities to use government schemes, building systems for accountability, and ensuring quality of services. A common thread I would like to weave through all these examples, and my piece of advice for NGOs is to complement the efforts of the government. Do not build parallel structures. Working together, we can streamline and bolster direct service delivery for the most marginalized population in the country. We must admit that despite these successful examples and a shared belief in the value of cooperation, coordination, the potential of NGO-government partnership in India has not been fully explored to its fullest potential. There is a trust deficit and lack of understanding of each other's work on both sides of this equation. But there are things both parties can do to make these partnerships more effective and mutually beneficial. For example, NGO must understand the constraints that the government works with. Proposed interventions must be designed for scale and within government budgets. Additionally, early involvement of the government helps necessary buy-ins and increases the likelihood of sustained support on a long-term basis. It's also important for the NGOs to coordinate with each other. Coalition among NGOs that bring together key stakeholders captures the government attention and builds credibility. Needless to say that the government too has been working proactively to create spaces for the partnership with civil society in service delivery. Ministry of Health and Family Welfare has been providing guidelines and making provisions within the National Health Mission for these partnerships. Let me conclude by saying that let us collaborate, partner, to work together, to put our best efforts together to achieve the goals which we are determined to achieve. Thank you very much.